Hello once again, and welcome back to Clinical Next with Dr. Abosede Adibute. Today, a quick one. Let's talk about diabetic foot care. Do you know anyone who is diabetic? Or are you diabetic yourself? Or you don't know anyone, neither are you diabetic, but you belong to a group where there are many people. Somebody in there might just have diabetes, and they need to hear this information. One major medical condition that ends people's life through foot damage is diabetes. A lot of diabetics have died simply because they neglected their foot care. Foot care is a major important part of self-care in diabetics because of certain things that diabetes does to the feet. And what are they? Number one is that it has the potential of damaging nerves, causing numbness, peppery sensation, loss of sensation in the feet. And so the person may not feel anything, even when they are terribly injured. Then it can also reduce blood flow to the feet, making infections and gangrene possible. Then it increases the risk of foot infection. Infections generally, not just foot infection. Infections generally because of the high content of sugar in the blood. So what is it one should do as a diabetic? How should you care for your feet? The very first thing is always assess your feet or look at your feet on a daily basis. So on your own, take a look at your feet. Are there blisters, redness, or soreness in any part of the foot? And if you have looked thoroughly and there are none, then on a daily basis, wash your feet very well. Dry the feet with a dry towel, including in between the toes. And once you have done that, please moisturize the feet. But do not moisturize in between the toes because you can easily have infections in that area, like athlete's foot. But do dry in between the toes. Then the next thing is never to walk barefoot. Either you are in the house or you are outside, please always wear something, a flip-flop or a slippers. The only time a diabetic may not bother about wearing a footwear is when you are on your bed. But everywhere else, you should equip yourself with a footwear. And your footwear should be appropriate. And that is because you don't want pressure on any area of the feet. You also do not want tightness. So you just want your shoes to fit correctly, and so that you do not have soreness in any part. Because if you do have soreness, you may not even observe, and it may not be painful because of loss of sensation in the feet. Another one is when you cut your nails, please cut with a nail cutter rather than a razor blade. Do not cut with something extremely sharp, and that's because you can easily get a cut. And do not cut the nails too low. So when trimming, do not trim it too low and trim it straight. Do not curve towards the nail folds so that you do not cause yourself ingrown toenail. An ingrown toenail can actually be readily infected. Another one is never ever make scarifications on your feet. I lost a patient to that. He just decided to make scarification as a form of therapy for a swollen feet, and then unfortunately that was the end. So do not make any scarifications. Blade, don't use razor blade to make cuts in your leg. And then if you ever find a sore on your foot, please see a doctor immediately, because there are people who ignore or trivialize such things and they say, no, it's just a wound, I'm dressing it myself. If you're a diabetic, you cannot dress any wound yourself. Let a doctor assess it before they tell you you can go ahead and dress it yourself. Then the next one is always ensure that you do regular exercise. Regular exercise will help blood flow to the feet to improve. And if you do that, the feet will be less prone to infections. But while doing your exercise, be sure to wear a very comfortable footwear. Then another thing is to ensure that your cholesterol and your blood sugar are well controlled. Cholesterol and blood sugar that are poorly controlled will make it easy or faster for these complications to set in. And finally, make sure that you see a doctor to assess your faith maybe once or twice in a year. It is important. But if you already have a neuropathy, you already have difficulty with sensation in your feet, then you might want to see a doctor more frequently concerning your feet for a general examination of your feet. It is so important because too many diabetics have been lost to feet conditions. Maybe a wound that they did not care for early, and then it festers and it becomes really complicated, and they die through that. So, like I said, you don't have to be diabetic before you will share this because somebody out there needs it. Thanks for watching. I hope it's clear and I hope it's helpful. Please remember, good health is great wealth. We will continue to be grateful for it. I'll see you again next week, God willing, with yet another topic. Until then, please be safe. Bye.